A lot of doctors who are thinking about leaving the bedside are asking themselves, what's the right time to do so? How much clinical time, clinical experience do I need to have until I'm ready to leave? And I would like to give you a couple of things to consider as you are contemplating on that question. The first thing is there is value in having clinical experience. The things you learn during your medical studies are great, but the things that you learn in the first couple of years of really working as a doctor are a whole different animal. There are so many more practical things that you learn. You learn a lot implicitly from engaging with other doctors, with nurses, with therapists, with patients in a way that medical school alone cannot teach you. So on your journey of being and becoming a doctor, investing at least a couple more years in having that clinical experience is quite valuable, also for many of the other roles that you might be interested in pursuing after you actually leave patient care. Another aspect of that is, of course, also fun and curiosity. We have chosen medicine for a reason, and quite often we do take joy in this whole medical world, in interacting with patients, in maybe also suffering through a night shift and the whole, insecurities that come with it, the growth, also the disappointments and the good moments. They do shape us for the rest of our lives. So there is value in spending some time. Now, the question is, for how long should you be doing it? And there is no generalizable answer. It really depends on where you want to be, what you like. But here are some thoughts. One danger lies in trying to set a goal and then reverse engineer from there. Because you might get to that goal and then realize, oh, it's not the goal that I wanted. Or you might never get there because life can be short or because something gets in your way. And so you also have to make sure that you enjoy the journey towards it. Given that you went through medicine, suggests that maybe you are quite able to go through a long suffering, to go through moments where you don't see so much enjoyment, and you are doing that for a reward that comes in the future. So especially for you, the message is true that you also need to balance enjoying the moment and enjoying the journey. It's not just about the end. It's not just about achieving your goals. Another aspect is that you have opportunity costs, and these opportunity costs come in different dimensions. One opportunity cost is, frankly, your salary. In many cases, people who leave the bedside will end up having a significantly higher income on the day that they sign a new contract in a new role outside of that. It can be 20% more. In my case, it was double. And that's only the starting point. Then it goes further and further. A second opportunity cost is related to your health. You might have jobs where you have more flexible working hours, where you can have a better nutrition other than what you can eat in the hospital or what you can take with you and snack in between. You will be able to have a better sports routine and better sleep. I know that we are willing and happy to, bear tough times, also over a prolonged amount of time. But take that into consideration nonetheless. And then there's another aspect. So we said financial, physical. Sleep, by the way, is also another aspect. You might have better sleep. There's another aspect, which is your learning. So after 3 years in medicine, you will already have seen a steep learning curve. And you can, of course, continue to learn more. But what if you would take that same amount of time that you then have and work for a consulting firm, work for pharma, do a research project somewhere in the field, in the place that you find exciting, or go back to university and maybe do an MBA or some other studies. If you compare these things, where do you think your personal growth journey would be bigger, and where do you think it would take you closer to where you want to be? Your time is limited, so, be mindful of that too. And these are, I think, the most important things to consider. Look at what careers other people have had. Look at, or maybe ask, if people are hiring doctors, what is it that they expect from these? In many cases, for example, some clinical experience is important. Sometimes they also want you to have published in a certain area and gain your accolades in that field. This is something you can continue to do even if you have left the bedside. Sometimes you can find part-time opportunities. It can also allow you to experiment and taste other careers. If you jump out only part-time or full-time for a limited amount of time, for a couple of months, you kind of take a clinical sabbatical and invest that into something else. So yeah, this is it. People sometimes will tell you, you have to get your specialty, you have to get yet another degree. Don't try to be a degree chaser unless it's really needed, and really focus on what do you want to learn and what's the journey you will enjoy.